You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia. Hello, everyone. Welcome back to Just Medicine. With this episode, we're starting a special multi-part series on gender affirming care. This series will explore different perspectives on providing inclusive and comprehensive care to trans and gender diverse patients. This is particularly important as transphobic policies are becoming increasingly more common. More and more states in America are implementing limits, bans, or criminalizing gender affirming care for youth and adults. This discrimination exists locally as well, with trans activists and care providers also being a target of hateful speech and threats. Given the current rising anti-trans rhetoric, it becomes important for us as healthcare providers to understand the broader societal context and ensure that, regardless of our intention, we're not contributing to a harmful environment for trans and gender diverse folks. So what is gender affirming care? According to the WHO, gender affirming healthcare can include any single or a combination of a number of social, psychological, behavioral, or medical interventions designed to support and affirm an individual's gender identity. Let's be clear that gender affirming care saves lives. Trans folks, particularly trans youth, are much more likely to experience depression, anxiety, and suicidal ideation, according to multiple research studies, both in the US and in Canada. Trans and gender diverse people are much more likely to delay seeking healthcare because of fear of discrimination or receiving inadequate care, whether it is misgendering by healthcare providers, non-inclusive facilities, or lack of provider knowledge. Further again emphasizing the importance of building a gender-inclusive approach to our practice during our training. Gender affirming care includes many different parts and processes. An important factor in providing this care is language. There are many terms that are essential to a care provider to be aware of in this field, and because of that, there is a mini bonus episode accompanying this series that goes over some common terms for those who are not familiar or those who need a refresher. In the next two episodes, I'll be chatting with three special guests: Ray Paxton, a trans educator and critical care nurse; Lucas Wilson, a care team coordinator at Transcare BC; and Dr. Nicole Thompson, an OBGYN resident and gender affirming care advocate. Our conversations span a lot of different topics, including some lived experiences of gender affirming care from Lucas and Ray, the process of receiving care in BC, the do's and don'ts of caring for trans and gender diverse patients, and what medical trainees can do to support this population. The discussion is split into two parts, with this month's episode focusing more on the experiences of Lucas and Ray, both as patients and as professionals. And then next month's episode will focus more on the process of starting and receiving gender affirming care. As always, the resources mentioned in this introduction and throughout the episode are included in the show notes. I hope you enjoyed the episode. Hello, everyone. My name is Shadan. I use she, her pronouns. And today we are doing a very special multi-part series on gender affirming care. I have three guests with me today who are working in gender affirming care, each in their own way within BC. So we have Ray Paxton, who is a nurse and a trans educator. We also have Dr. Nicole Thompson, who is an OBGYN resident at UBC, and she's also very passionate about gender affirming care. And we also have Lucas Wilson, who is a trans care coordinator at Transcare BC. Without further ado, I'll ask each of our guests. Maybe we'll start with Ray to introduce themselves and tell us a little bit about who they are.
Hi, everyone. Thanks, Shadan, for the introduction. My name is Ray. I use he and they pronouns, and I'm calling from the Squamish, Musqueam, Tsleil-Waututh Nations. I am a trans educator, a nurse educator for Transcare BC, but I also am a critical care nurse working in two post-anesthetic recovery units within Vancouver. I've been a nurse for around 10 years, studying at the University of Ottawa and working within multiple surgical CCU and PACU settings for about 8 years in Ottawa, and then moving over to BC in 2020. Since moving to BC, I've been working in various roles in PACU settings, really trying to highlight and emphasize my focus and care on gynecology, gender affirming spaces before recently transitioning to Transcare BC.
Thanks, Ray. So we'll transition to Lucas.
Hello, my name is Lucas. I use he, him, his pronouns, and I'm calling in from the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm a coordinator at Transcare BC. I was formerly a health navigator, and prior to that, my origin of in this work is within youth work with queer and trans youth. And I've also done a lot of education BC-wide, again, with a youth focus. So youth work is where I come to this work from. It's still a perspective that I carry forward with myself today, even though I work with populations of all ages and all genders. The focus of my work is multifold. I do a lot of different things, including education, but look a lot at systems navigation for folks who are navigating care. So how folks connect to care, how care systems are integrated, talk to each other, and focus and incorporate the needs of trans, gender diverse, and two-spirit people as they would anyone else. I'm currently completing my master's of public health at SFU, and I'm really, really excited to be carrying that new knowledge forward with me in the work as well.
Thanks, Lucas. And then finally, Dr. Thompson.
Hi. So Shadan, thanks so much for having us. I'm really excited. So my name is Nicole Thompson. I use she, her pronouns, and I'm also calling from the Squamish, Tsleil-Waututh, and Musqueam Nation. So my background's kind of funny. I actually didn't start medical school until I was 31 years old. I did 10 years of occupational therapy and healthcare management prior to applying to medical school and somehow getting in, which is really kind of impressive. So I did most of my practice in Edmonton and then did medical school in Calgary. And then I've come to Vancouver to do my residency in obstetrics and gynecology. My interest in gender affirming care comes from this really interesting incident that happened in medical school, actually, where we were talking about what they used to call, they do not call this anymore, but well man and well woman assessments. And essentially that's a genital exam for a cisgender person is what they're called. And I, asked during a lecture why they didn't include people who are not cisgender or who had non-binary identifications or who had undergone any surgical changes with regards to gender affirming care. And my university was like, we just haven't done that, but you'd be welcome to do that or introduce that. And so herein started my journey of mentorship and gender affirming care. We ended up writing a curriculum that was implemented in the University of Calgary. And then we've also recently published in Perspectives on Medical Education on a gender affirming care framework and medical education. And then in BC, I'm trying to transfer that knowledge working with University of BC Medical School, as well as the residency programs here, and have further increased my knowledge by doing electives in the gender affirming surgery program here. So, and have a few other studies going with regards to gynae practice and actually sexual medicine too for trans and gender affirming care. So I have a real love, a real passion for this area. And I don't know, it really is the most fun area you can work in, to be part of someone's journey of becoming who they are. It is it's really special. And so that's, if anything, what I can sort of share with the group is just how beautiful of an experience this really is. So, and to encourage people to be a part of this. Yeah.
Thanks, Dr. Thompson. And yeah, actually, I got connected with Dr. Thompson through a kind of extracurricular lecture that we got from her on Gender Affirming Care. And when I mentioned to her that we were starting this podcast, she was very excited to join, and she connected me to Ray and Transcare BC. So this is how we really have such wonderful people coming on, talking to us about a really important topic. And I think, Dr. Thompson, the way that you described about how change comes in medical education is really that one really passionate medical student or resident who comes in and says, I want to make a difference. And that's how we create grassroots change in medical education. And it's really good to see that it's spreading from Alberta over to BC with as medical trainees move around the country. Like I mentioned, I got in touch with Transcare BC through Dr. Thompson, and we actually have Ray and Lucas who both have lived experience seeking gender affirming care. So I want to ask, maybe we'll start with Lucas. Can you share some experiences with us in seeking healthcare as a trans person, both in terms of just general healthcare and also any experiences seeking trans-specific care as well?
Yeah, of course. So I have a pretty long history in terms of seeking gender affirming care. I started seeking gender affirming care 13 years ago, give or take. I'm not great with mental math, so that could be a little bit off. But it was, 13 years ago, not that long ago in the grand scheme of I think how we think about time and sort of the developments of medical pathways and medicine. But in terms of gender affirming care time, that was actually quite a long time ago. A lot has changed. And so when I was accessing care, certainly a lot of the systems we have now were in place. It was very sort of secret knock. It still is to some extent, but it's gotten a bit better where you sort of had to know exactly who to talk to. The first person I talked to about gender affirming care was in a converted closet inside of a mental health office where this small program called the Trans Health Information Program was situated out of. So I went into this as a sort of late teenager, went into this very small closet room and sat and talked with somebody for the first time about gender affirming care. And then was very privileged to be connected almost immediately to a provider who I could really speak with and go into depth into, and who sat with me and really listened to what I wanted, what I had to say, and was really open to exploring with me what I wanted. I had a really positive experience accessing care. All things considered, I think I count myself as very lucky from those initial experiences, especially given the time. And I think that's because my provider was somebody who's already experienced in gender affirming care, so that really helps. And was also just really open to listening to me, and really appreciated sort of where I was with my gender journey, which was coming out, but not out to everyone. And I think she really understood that it wasn't just a sort of one size fits all situation, that folks are sort of in the midst of a journey and maybe accessing care at any point in that journey. Since then, I've had good experiences and bad experience in terms of accessing general primary care. I had this really great affirming experiences of finally transitioning out of my trans-specific clinic after, again, this happened recently, 12 years at this one clinic. And I finally said goodbye. I probably don't need this specific help anymore. And went to find a provider in community and was just really ready to, I work in trans health. So I was quite ready to just not fight, but just come in sort of swinging in terms of I'm going to expect my provider won't have any clue how to support me. So I'm going to come with my resources. I know what to say. I know what to do. And I walked in and met this person. He's like, oh, I actually have a fair amount of experience with gender affirming care. And he had all of this prior experience, and he knew immediately oh, you need hormone monitoring? I got that. I actually have a few other trans patients. And he sort of had it all down pat already. And that was just so surprising to have that burden lifted off. And oh, I actually don't have to explain my care or what I need to this person. Whew, that's a big load off. So I think that's my experiences have really been shaped, probably a lot by my privilege. I should mention I'm a white masculine presenting person. So that certainly plays into how I'm able to access care. But I've also just been, I think, quite lucky with the providers I've been in conversation with. And I think that's really just shaped my positive experiences of care.
Lucas, can I bug you to
Yeah.
maybe share a little bit about how that experience can go when it's not so positive, just so medical students sort of know what, you know, the more negative experiences have been, and then that can also give us an idea of comparison, also how to negate that in our own practice.
Yeah, and I struggle because I have like those experiences for me haven't been too many, but I think I can think of some smaller instances, and I think a lot of them can happen at the front end of care. So I think where I've really experienced negative care encounters, and as well as the folks I've like the youth have supported access care, it's they often don't even get in and see the doctor. Those experiences are often happening outside of the office where folks are presenting for care, and just that check-in procedure of like, giving your what do we all have to give when we show up to a medical office? Our first and last name, which first and last name that can sometimes be confusing, and having to explain it. So it's going to say my legal name, and there's going to be an F on my gender marker. I use him as pronouns. I don't use that legal name, and just making sure that that's then translated into who's calling me into the medical office, and if they're going to use that legal name. And I think a lot about an experience I had with a youth who I took in to see a doctor. This youth was trans. It took a lot to get them in to see a doctor because they, unlike me, had not been very lucky with their previous experiences. And we checked in. We tried to do everything we could to make sure that youth's name that they go by was going to be used to call them in, which was a masculine name. The name on their ID was a more feminine name. And explained, so this person is trans. This is what their ID says. This is what they need to feel respected in the space, and this is what we need to happen. You need to call them in by this name, and this needs to be communicated to the doctor who will come in and see them. And we thought everything was good. We sat down. They called the youth's name. The name called is the name on their care card. It's the legal name, and that youth. Yeah, and that my heart kind of sank, and that youth waited a beat, and we were near the door, and they got up and they left, and they just left because. In that moment, had they done anything else, that would have outed them to the entire room of people, and they were instantly unsafe. So there actually wasn't a way for them to move forward with care in that moment in a safe way. They had to leave. We tried again. Eventually we got them in, we fixed it. But I just think about like those little moments before they've even come to see you as a provider, like that can be make or break. So you could be like the best provider ever. And in this instance, if they had been in to see the provider, I'm almost positive they would have had a great experience, but they didn't even get through the door. So that's what I think a lot when I think a lot about negative experiences, at least from my experience.
I think that's important to highlight too, Lucas, is that one instance might impact that current encounter with the patient, but it can also delay and prolong people's dysphoria, their distrust for the medical system. It can cause a whole cascading of negative effects down the road, which I think a lot of people might not be aware of in the moment, that where it's affecting more than just this initial embarrassment and feeling of being misgendered, it's also impacting so much else.
And if I can add, for medical students and residents, something that I do is I always know what my OR slate looks like prior to. And I know that if I have a trans or gender diverse person coming in the next day for surgery, I go very early. I grab the chart, and right now in some of the hospitals, there's paper charts. And I go and I literally scratch out every name that person doesn't use. I look at every sheet of paper. I find every OR slate that's written, and I scratch out if their dead name is on there, and I write in their name and their pronouns, and really, really try hard to set people up for success. And that's a little thing that medical students, junior residents can do, because most of the time you know your OR slate in advance. So that's sort of a safety piece that I think is a good role for a med student, to be honest.
Can I interject and ask a question? How would you guys recommend a medical student or resident correct someone who might be more senior than them, so a resident or a staff who does use a dead name or misgenders a person who's trans or gender diverse?
That's a really good question. It actually comes up quite a lot in healthcare settings. I feel like healthcare is still quite hierarchical and a little bit archaic in how we feel like we are able to speak and not speak in certain situations, depending on the seniority level of who's in the room. But I think it's the same for anybody that makes a mistake with someone's name or pronouns. It's just gently correcting them, being like, oh, Nicole uses she, her pronouns, and then just asking for them to like basically acknowledge what you've said and then move on to the next sentence and not dwelling on the situation.
Yeah, I agree. I think I come at this from a different perspective too, because I was a little bit older when I started medical school, so I had not a lot of trouble correcting people. But I think that's maybe age maturity and also a real desire to protect the community that I care about. And so I agree with Ray. I think like a kind correction, and coming from someone now who I'm a senior resident now, and if a medical student corrected me on pronouns, I would actually be really grateful. And maybe I'm different, but I do actually feel that I believe that people generally want to do good in the system and they want to learn more and perform better and provide safe care. So I think if you come at it with that perspective, that this person actually probably doesn't want to create a negative experience for this individual who's seeking care, and that they made it a mistake and I can help them learn. I think that's a good perspective to come from, and to also remember why we're all in the healthcare system. It's not, yes, there obviously it's a bit selfish because I love the work I do. I get a lot of value from it, but it is to take care of people who access care. And that above all else, of anything else that you do, is your job. And your job as a medical student, because you are still part of the care team and the care system. And so having that confidence to gently correct someone, I think, is really important. And the other thing that I might add as well too is just as you go through your journey in medicine is just to maintain humility all the time. And to know that if someone corrects you, that they feel safe to do that with you. And that's actually a compliment. You know, the landscape changes, vocabulary changes, and you have to be open to the fact that you're not going to know that all the time and that someone's going to come and know more than you and teach you more. And that's how I look at it, is like, thank you so much for correcting me. And so maintaining humility throughout your journey, I think, is really important.
I really appreciate that. It's kind of that extension of lifelong learning. Doesn't only apply to the medical content, but how the art of medicine kind of changes over time as we become more aware of the different healthcare needs of different underserved populations. Ray, can you share a little bit about your experiences, good, bad, all of it?
I'd love to. I'm fortunate that through my medical and surgical transition journey, it's been largely positive. I chose to wait to transition until 2020 for a number of reasons. I was pretty high up and heavily involved in gendered sports, and I wasn't ready to give them up. I thought that if once I started to transition, that might be the end of the things that I loved to do at the time. And I did have firsthand experience and like awareness of the inherent transphobia that was a part of Ontario nursing and healthcare culture. I had a couple of trans friends that were both out and then stealth that had some really significant negative consequences to the profession as a result of being transgender. And I was, I don't want to say it was selfish, but I wasn't ready to give up my hopes and dreams of becoming like a critical care nurse, a surgical nurse, someone that works with largely in gender affirming spaces. I wasn't ready to give up my work and professional progression in order to transition. So I did have a brain injury a few years ago, and then at that time, like a lot of things in my life changed, and I was ready to start transitioning. So I moved here in 2020 and started my medical and surgical transition basically as soon as I got here. And I think definitely, like Lucas touched on, being a white settler and someone that's masculine presenting did provide me with a lot of fortune in accessing this care, and then also being a part of the healthcare system. I think I had a bit more knowledge of the ins and outs and things that I needed to have when I was requesting care. But everybody from my family physician, lab techs, all of the surgeons have been absolutely incredible and so affirming. I don't think I've had a negative experience yet with those populations. A couple of small things in hospital when accessing surgery, but really just so minor that it's not really worth bringing up. But my negative more trying experiences accessing healthcare as a trans person has been when it's not related to my gender. For example, I had unfortunately another concussion this spring, and the insurance company made me go through a series of hoops because they decided that my concussion was not a concussion. It was just symptoms of my hormone therapy and gender identity.
No.
Yeah, so I had to do extra lab work to confirm my hormone levels. They had questions, and I had to speak to counselors and other mental health professionals about the surgeries that I've had, how happy I'm with my body, whether or not I'm receiving specific surgeries, and how that's impacting my sex life in order to receive compensation for lost wages. So that was particularly difficult and trying, given that I had so many like notes and supporting documents from physicians and OTs, PTs, neurooptometrists, and that stuff. So I feel like that was quite traumatic, and I'm still kind of dealing with the fallout of that to this day, to be honest.
I think you touched on a few things that I want to expand a little bit more. One is the kind of nuances in seeking gender affirming care and how it intersects with racism and sexism, like you mentioned, like being a person of Caucasian descent, like white presenting and also masculine presenting makes a difference in the care that you receive compared to femme presenting patients, and also especially like patients of Indigenous or Black or other communities of color, how they get care. And the other thing that you mentioned is kind of that what's called the broken arm syndrome, that if people aren't familiar with it, it's the kind of scenario where a trans or gender diverse person presents with a broken arm, and the provider tries to kind of evaluate their broken arm from in the context of a trans person receiving care that's not really gender specific at all. So like, and it can actually be traumatizing, like you explained, and I'm really sorry that you had to go through that, and it has repercussions for such a long time. So for our listeners, if you're interested, you should definitely read a little bit into the broken arm syndrome, and also the nuances that both Lucas and Ray mentioned about how it differs based on your other kind of intersections of your social determinants of health when you receive care, even within a smaller space such as the trans community. I think Dr. Thompson, you wanted to add something as well.
No, I'm emphatically nodding. Like this is, it was such you present so well, I have to say. Like the way you summarized that was great. And actually, I was wondering if Ray or Lucas could comment on intersectionality and how that affects gender affirming care.
Happy to. Maybe I'll start off, and Ray, feel free to note as well. But so when I mean, as Ray and I both mentioned, the impacts of colonization, of racism, of sexism, of ableism, those don't just not matter. If somebody's trans, if somebody's trans, they experience transphobia, but layered on top of that can be additional layers. If a person is a trans person of color, there's an additional layer of transphobia plus, or actually it's more cumulative racism, and then those things are compound as you add more and more areas of marginalization that person experiences. So when we look at specifically statistics around the health impacts of transgender versus two-spirit people. We see that trans people of color, for example, experience much higher levels of violence, of HIV. There are a number of different studies in the United States. There's one called Injustice at Every Turn that looks at the specific impacts of folks who are trans and also a person of color. And we just, again, you can see the impacts of transphobia culminating alongside racism, which really puts people at pretty profound disadvantage in terms of their care access, inequitable access to care. And I think we see that a lot in healthcare, or in any sort of systems of care, in terms of how people are able to show up and present to care, and how they're able to cope and navigate within systems of care that are not built. So when a trans person presents for care, they're inevitably presenting for care in a system that is not built for them. Like healthcare, like every other system, is built for cisgender folks, and that's just the reality. So if that person is then not dealing with any other discrimination against themselves and their identity, they might be able to maybe cope with that a little bit better. But the more we add on to that, if they're also having to combat racism in that same system that, again, is built for white people, then it becomes increasingly harder for that person to fight through that system and get what they need. So I think that's what comes to mind for me. Ray, anything? I'm sure there's lots more to say on that. I know there is. But
yeah, I feel like that could be a whole discussion in itself. I'm going to touch a bit on the masculine piece, and in medical care and in general world views, the male body and the male presentation has been the quote standard or norm, and anything else deviates from that. And in our medical history and in our learnings, it was studied pretty much solely on the male body through the male gaze and through Western medicine. And I think that cis women have tried really hard to break down that barrier to where we're at a point where we're studying equally different kinds of bodies. And I think that we also need to bring forth that trans and gender diverse people, two-spirit people, we need to also bring them forward. So we're learning from all different kinds of bodies, all different kinds of situations, so that we can all be seen and respected and validated in our healthcare equally.
I'll add that if folks are interested in doing further reading, I really suggest reading up on, there's a term called transmisogyny, which is the specific experience of discrimination that trans femme folks encounter. And I think that just knowing that term and doing some research on that term, I think helps to really backbone some of what we're talking about in this instance.
Yeah, that's a great plug. Thanks, Lucas. And then I think you also mentioned a question about like the broken arm syndrome in trans people accessing care for non-gender related care. And I think it's super important to highlight that it's important that we step away from pathologizing trans bodies and using trans and non-binary two-spirit people as learning tools in our journeys. Like I know that medical students and residents and fellows, everybody's constantly learning on the job. Healthcare is fluid, but it shouldn't come at the expense of a person's safety and dignity and well-being.
Can I actually ask, so about learning experiences? So now as a resident, I'm still a learner as well too. And then I have medical students with me, and I want to give them all of the opportunities I can to learn and experience trans care and gender affirming care, and to interact with trans folk. And I struggle actually with how to consent people for a visit with a medical student, and how does that look in a healthcare setting? Can you maybe comment on that?
Yeah, I'd love to. I think it's important to highlight when requesting this for like a patient's consent for having medical students present, that we make it aware to them, the trans person, that we ask this of everybody. We have medical students involved in so many different capacities, and that we're not solely focusing on the trans person. It's just another area of learning for medical students. So I think that's really important to highlight so that patients can understand the why and the intention behind the request. But then on the other side, I think it's important for medical students, and maybe if you're a resident and you have, say, 5 or 6 that you have for a certain amount of time, keep track of who's seen which learning experience or has had which exposure, so that everybody gets exposure over the period of time that you're working together, and you're not sending 3 people in to do a bimanual exam after a patient's been anesthetized for a gender affirming gynecology procedure. You're giving someone like one person at a time, staggering it so the patient doesn't feel overwhelmed or doesn't become pathologized.
That's really helpful. Thank you.
Yeah, of course.
On the topic of kind of medical students in gender affirming spaces, I want to ask you guys, what are some ways that medical students, and we kind of talked about this already a little bit, but what are some ways medical trainees, so medical students and residents, can support gender diverse and trans patients from signaling that they are a safe space for that person to come out if they feel ready to, all the way to throughout getting medical hormonal support or hormonal treatment or surgical treatment or mental health treatment throughout this whole process. So kind of long-term support. So anything that you guys think of would be very appreciated.
This one might be kind of, I mean, I think it seems minor, but I think it could be pretty major. And the first thing I'll mention is just simply introducing yourself using your pronouns. So I think that this is a big signifier to not everyone, but I think a lot of folk, including myself, who I talk to, where if they encounter a provider in a healthcare hospital setting who sits down and says, "Hi, my name's Dr. So-and-so, my pronouns are he, him, she, her, hers, they, them, theirs," that invites a bit of an opportunity to have that further dialogue, and invites that person to introduce themselves by their pronouns if they want to, right? Like, I don't think we want to force or pull things out of folks, especially when it's not necessary to their care. Like, again, the broken, you said broken arm. I'm familiar with the broken elbow. So you might encounter either reference for that story, but so that person just might not want to come out in that situation. That's fine. But I think just using pronouns and introducing yourself by your pronouns, if that's your practice, it might not be your practice, and that's perfectly fine too. But just offering that invitation to have that discussion, and also being aware of your surroundings and asking questions about your surroundings. I think facility access is a really, I'm sure we'll talk about this more, but is a really important factor when it comes to patient safety. So if you're in a space and you're encountering that there's only binary washrooms, asking the question of, like, where do our clients who don't feel safe, comfortable, able to use either of these washrooms go when they're changing, when they're using the restroom? Because often it's these decisions didn't come about because somebody's out there like trying to get people. It's just because nobody's thought about it. So I think that learners and residents can just be can ask questions that perhaps nobody has thought to, because I think a lot of time we operate off of like, well, we've been doing this forever, so therefore it's the best way to move forward, and often that isn't the case. So giving those little interruptions to the status quo where possible, I think can go a long way.
And I think my advice for medical students would be to do the work on your own unconscious bias. You cannot be a safe space for a patient to disclose if you have not yourself explored your own bias. And that's really, really hard work to do. And I think it's, you cannot go out into a community and claim to be a safe space if you haven't done the work to be a safe person. And so I do tell people, if you're going to wear like a she, her, pronoun pin, or you're going to wear a trans flag or a queer representation flag on your lanyard or something, like, then you need to have done the work. Because if you are signaling that you're a safe person and you are not, in fact, a safe person, that is actually quite dangerous for the community as well, too. And so listening to, this podcast, reading about trans misogyny, thinking about how you view gender and your own gender and how gender, is a construct in the world. I think that's actually probably the most important step. And then everything else will kind of fall into place. You do become more humble and more aware and more, just more complete, I think, as a person when you've done that work.
I think those are both great ideas, Lucas and Nicole. And I just would like to kind of add on to those ideas. The pronoun pins and the trans flags on the lanyards. I think in theory, they're wonderful, especially in hospital situations when everyone is in scrubs and caps and masks, and you lose the ability to self-express your gender. But I think it's so vital, like you said, Nicole, to back that up with your own learning so that you can really become a safe space and provide trauma-informed care within your practice. But I agree that those little pins are a great nonverbal icebreaker, especially in situations when you aren't able to express anything else. And you're in an environment that is not your own. You're in a hospital. You're not in your own clinic where you can provide your own space. So I think those are both really great examples.
So I think what I heard was kind of two domains that we can work on. So logistics was kind of what Lucas was mentioning about having a universal washroom, like all genders welcomed washroom, having spaces that are welcoming, and taking those moments of pause to see, okay, we have been doing things a certain way, but is it necessarily the best way? And then the bigger component goes towards the unlearning of your bias. And I think one concept that I became familiar with through this work about just learning about social justice and social justice in medicine was the concept of unlearning, and the things that we have been told aren't necessarily, just like Lucas said, the best way to do things. So taking those away and replacing them with new concepts that are more inclusive and more comprehensive. And the other thing I want to mention is that those pins not only signal to the people who know what it means, but it also helps kind of normalize, especially as someone who has the privilege of the cis privilege, I guess. To be the person who explains. I've had a lot of patients, because I wear that little pin that says she, her. A lot of patients ask me, why do you wear that? And the labor of explaining that falls onto me, who has that privilege. And I think that's one of the ways that I can take off the emotional labor, or just the concept of having to explain things, like Ray was and Lucas, they were both mentioning, of that burden that now I have to go in and explain myself and what I am and who I am. And maybe that's kind of one of the ways that I like to think that I'm helping. I hope I'm helping take that burden off and educate people who don't necessarily know about it as well.
I have a story to share about this.
Nicole,
It's so interesting. I presented at a conference, a gynecology conference, I think like 6 years ago or something like that, on the curriculum that we wrote for Gender Affirming Care. And I was just standing in front of my poster, like a medical student, all dweeby, and in my like suit jacket that I felt really uncomfortable in. And I had this like group of people, I think there's about 5 or 6 in front of me. And one of them was this like older white male. And he asks me, he's like, "Excuse me." I said, "Yes." And he said, "Why do you care so much about this? Are you trans?" In front of a group of 5 or 6 people. And I was just like, it threw me off my heels for a second. And then I looked at him and I says, "You actually have no right to ask me that." And I just waited, and he kind of giggled a little bit. And I said, "I don't think that's funny." And I just straight like deadpanned him, and everyone else just kind of like looked around. And then I sort of kept giving my talk, and I was like, "You don't deserve this. Like, this is so," anyways. And so my privilege in that situation was that I was presenting, and I was also confident enough to direct that in a different way, and also to call out that behavior. And so I think, anyways, if I think about that in myself and how often that probably happens to people, in healthcare settings and things where bits and parts of them are disclosed on paper and in charts and things like that. And it made me uncomfortable. Like, we really need to make safe spaces. Anyways, that's my story. What's yours, Ray?
Oh, it's totally not like yours, but I love that story. Thank you for highlighting that those comments can happen anywhere and to anybody. But so when I work at the bedside, I do have a trans lanyard and pronoun pins, and I just feel like the more representation, the better. I welcome the discussion. I would rather help one person and deal with some negative fallback than not be able to help anybody. And I was checking in a patient for surgery, just a regular routine surgery. I introduced myself, told them my name and pronouns, and then asked them their name and pronouns, and they just paused, and I didn't know if they heard me. I was like, "Oh, I'm not sure if you heard me. It's kind of loud in here. Just wondering what your name and pronouns are, if you're okay sharing that." And they started to get really emotional, and then I was just like feeling a bit uncomfortable. I was just like, "Oh no, like, are you okay? What's going on? Like, what can I help you with?" And they disclosed to me that this was one of the first times that someone's ever asked them their name and pronouns, and they've been struggling with their identity and thinking that they're a non-binary person, and coming in a normally very gendered clinic that I was working in for a very gendered procedure, they were able to express that they have these non-binary feelings, and they want to explore more about different options and different supports that they might have. And it honestly just felt like the biggest win. Like, you've been doing this for so many years, you get so many questions and side eyes and eye rolls, and to just have that one person feel safe to just express who they are and begin their process, it was so worth it.
Just wanted to quickly comment on, I think both those stories, but I think, Nicole, your, like, that story, I think just really stuck with me. I think the questioning of like, oh, you must only care about this because only trans people would care about trans people, or it must be like a special interest in order to be caring for trans people. I think that something that I think sometimes comes up is that there are only very specific areas of care where trans folks will present for care. That like not all providers need to be sort of aware of trans folks, because not all providers work with trans folks, and I think that is absolutely incorrect. Like, I think you'd be hard pressed to find a provider who has not ever worked with a trans person, but you will find a lot of providers who have worked with trans people who have not felt safe, or who've opted not to be their authentic self within that care setting, because of things that Nicole and Ray mentioned, where there haven't been those signifiers, those signs, that safety for them to come to care as their true self. I kind of laugh a little bit when I hear like, oh, I've never had a trans person in my practice that you know of. Like, you probably have. And that's because trans folks are everywhere, and you will never know how many trans folks are in your practice, even if you're the most affirming provider, because you can't know or not know who a trans person is. So for somebody to just I think assume that there must and somebody must be trans, or there must be some sort of underlying motivation to be gender affirming. Like, no, it's you're wanting to be respectful and affirming of your patients, because you know that there will be trans folks in your practice, and that all providers should have this competency. So I just wanted to make that little comment because that really stuck with me.
I appreciate that too, because that was also a thought I had afterwards. But in the moment, I was like, ah! I was a mess. Oh, man.
And that's it. You feel so caught off guard in the moment that sometimes you just don't know how to respond. And it's not, you just feel at such a loss for words in the moment.
Yeah. Anyways.
Well, I think sometimes because those comments are sometimes purposefully positioned in a way to make people feel off guard or uncomfortable. I think in that case, it was very much a comment that was meant to make you sort of feel off. Sometimes those things are quite pointed. And I don't think we have to, we don't owe the other person to respond perfectly in that situation, right? Just because somebody makes you feel uncomfortable doesn't mean that you owe them a perfect response, right? Like, and I think that was a perfect response, just to say like no, none of your business, like not appropriate.
Yeah.
Like, wow, what an
Yeah.
inappropriate thing to ask somebody in the midst of a lecture. Like, wow, yeah.
Lord, like, or ever, really. And can I ask you guys, so often questions that I get from the cis community and are, well, has this person fully transitioned? And I say that in air quotes. Can you, and I know the answer to this, but I think, can you explain transition? What is transition? And why is fully transitioned not really?
Can I
Go
just
ahead, Shadan. Yeah.
interject? We're gonna talk about the process of transitioning in the next episode, and then maybe we'll just tease it right now, just to give like a one-liner of what is transition, and then we'll talk about it fully in the next episode. I think that's a really, really important thing to talk about. What is quote unquote fully transitioned? Maybe we can get like a little teaser of, spoiler alert, what's to come from Lucas or Ray, and then I want to touch on one more question before we end off the first part.
I can take that question. Yeah, transition is so multifaceted and it's different for everybody. Everyone's transition is unique, and there is no one right way or wrong way or complete way to transition. People can medically or socially or legally or surgically transition, and it can be fluid throughout a person's lifetime. But I think we'll talk about later about the different kinds of ways someone can choose to make changes or steps to feel more themselves and in their own body. But just to inherently say that there's a transition or to complete transition is false, because there's so many different ways and it's such a spectrum.
Great. That's exactly perfectly gives us a little teaser about what's to come without really spoiling all the fun that we're going to talk about in a lot more detail, because it is a complex and multifaceted, like you said, different domains that is involved in a process of transition in general. I want to end off with like a question, just kind of changing gears. That we've talked a lot about gender affirming care from the patient perspective, but both Lucas and Ray are also gender diverse practitioners in healthcare in their professional role. So I want to hear a little bit about your experiences being a trans person in healthcare and working in healthcare.
I think for me, so I'm a non-clinical provider. The way that I'm sort of providing care and interfacing with patients, I don't do a whole lot of that anymore, but it's primarily through sort of systems navigation work, some sort of peer support as well, and just directing folks to where they need to go to access care. I think that as a trans person working within gender affirming care, I think sometimes there's a lot of tension between I think when we're speaking with, or at least I feel that sometimes when I'm speaking with providers or folks that I'm liaising with to sort of to coordinate care for folks, there can sometimes be assumptions that I am trans, even though I haven't disclosed that. So related to Nicole's last note there, or that I'm I think sometimes there might be an assumption that I might be working from a capacity that's perhaps less professional than I actually am working within. And of course, as a trans person, because this does happen a lot, but the pain that you hear reflected to you from the patients you're working with, who often express lifetimes of discrimination and not inability to access care and really terrible care experiences. I mean, you take some of that on. It's hard not to sort of see and find your own experience echoed in what folks say to you. So it can be difficult to, I think, hold, but important to hold that place for other trans folks as a trans person. And I think that on our team, we've often talked a lot about like how we can use and work within each other's different positionalities to sort of best hold that space for folks. Because certainly there will be some situations where based on my experience, like I might not be the best person to hold space for an individual, but somebody else might be better place to hold space for that individual, right? Like such as like a parent who's like really needing to talk about like how hard it is for them to accept their trans kid. That is so important for that person to talk about. And maybe not always with a trans person, because some of the things they're talking about might be really transphobic, and so that might become unsafe. So then, how do I pull them on my colleagues to maybe say, well, absolutely important conversation to have with somebody who's perhaps an ally and not someone with lived experience.
I think that's a great example, Lucas, and I'd like to kind of piggyback on that a bit. Being a trans person working as an educator, I have multiple feelings about it. I feel grateful that I have an ability and a capacity to help educate others in the healthcare field. Patient advocacy is one of the biggest reasons why I am a nurse and why I like to educate people. I feel like our healthcare system has a lot of downfalls and isn't really designed for anybody to seek great care, regardless of their gender identity. But as Lucas and everyone said previously, it really is another barrier when seeking trans care, and I'm trying to do my part to help break down those barriers so that when people access the care, they don't have the experiences that Lucas and I have heard about from other trans people or that we have experienced ourselves. I would like the next generation, the next person, to be able to go in and have a truly affirming, safe, and dignified experience. But the flip side to that is some of the questions that I get, or the requests to help when I'm not in my position at Transcare BC and when I'm at the bedside. I wonder if people are using my position as a trans person to do the work for them, to take on an extra burden that other people might not have in my position. And while I normally I don't mind, especially when I'm in my nurse educator role at Transcare BC, that is my job. That's what I'm here for. I do find that often I'm pulled in multiple directions when I'm in bedside capacities to maybe provide more support than a cisgendered nurse might have to do in the moment. And I think that's where I find I kind of struggle the most with that. And I don't really know, like, I don't want to say no because I want the person to have the information to be able to give the best care for that patient, because I truly feel like everyone's trying their best. Everyone wants to learn to be better, but how we burden those who are already predisposed to have extra on their plate. And I think it's really important to find that balance.
I think you said it so well, and I think that's something that a lot of people grappled with when the equity, diversity, and inclusion committees became very popular at different organizations, corporations, and a lot of people who were already part of the marginalized groups were asked to step up and take that extra burden and provide that extra emotional labor to educate other people. And I think you're 100% right. Like, speaking from someone who is a person of color and a woman, being in that space where I have to be talking about the things that create that are barriers for me is hard when there is so much resource and everything available online. But I also understand that if I'm not the one who's talking about it, then who will? And I do really agree with you about, people do want to do better. It's providing that space, but it is also kind of, how much do I take from myself to give to other people? And Dr. Thompson, I think you wanted to mention something.
There's an excellent paper on this called Racialized Equity Labor. And it talks exactly about this, how people from, marginalized or vulnerable communities are asked to do free work. And this paper specifically talks about universities. They do this free work for the university, and then the university promotes it as a university level activity when really it was unpaid work from a community that is under-resourced to begin with. So it's interesting. I think, yeah, I could talk about this forever, but anyways, it's really, really good to be aware of, and also to think about when we ask community members to help with teaching initiatives and things. Shadan, as you did, you were like, I'm not going to do this unless they're paid, and we need to do, this work through appropriate channels. So we're not asking people to give free labor for education. And so I was really, really impressed with your doing that and being aware of that.
Thank you. And I think that should just kind of become standard. I don't want to take that. I appreciate the appreciation, but I think that should just be what it is. I don't think we should discount emotional labor, especially from people who, like we mentioned already have enough on their plate. And I do really appreciate that that we do have this opportunity through Transcare BC to bring on people with lived experience like Ray and Lucas to share their experiences with us and really educate us and help us share this education with other people as well. I think that's a really lovely note to end our first half of this multi-part series on gender affirming care. We're going to continue recording, but for everyone listening, this has been the teaser about what's to come. I will share all the resources and all the terms that were mentioned about if people want to read more about them, and all the articles and studies that were mentioned by everyone. So you can find those in the episode show notes. Thank you for listening. And this has been Shadan with Just Medicine. Thanks for tuning in to Just Medicine.